The shoulder, a ball and socket joint, is the most mobile joint in the body. Because the shoulder is stabilized by muscles and tendons rather than by bone, it has a wide range of motion. However, this great degree of motion has a trade-off. The stability of the shoulder is dependent upon the surrounding soft tissue and can result in a number of problems not faced by other joints supported by bony structures. The shoulder is comprised of three main bones: the collarbone, clavicle, the shoulder blade, scapula, and the upper arm bone, humerus, which extends from the shoulder blade to the elbow. A healthy shoulder can be damaged by disease, such as arthritis or injury, resulting in severe pain, pseudoparalysis, false paralysis, and muscle weakness. When the cartilage wears away, bone-on-bone rubbing occurs, resulting in lack of range of motion and pain that affects the day-to-day activities. When non-surgical treatments are no longer effective, it is time to consider total shoulder replacement. Shoulder replacement surgery is performed through an incision in the front of the shoulder long enough for the surgeon to see and access the joint. Once the surgeon exposes the shoulder joint, the head of the humerus is removed. The socket, glenoid, is cleaned out and prepared for the implant. A polyethylene plastic insert is cemented into place to recreate the natural contours of the bone in a healthy shoulder. A metal stem is either pressed or cemented into the hollow canal of the arm bone, depending on the surgeon's preference. A metal ball is then secured to the top of the stem, in place of where the arthritic humeral head used to be. Once the implant is in place, the surgeon sutures the incision and applies a dressing. The specifics of recovery and rehabilitation will be determined by the surgeon based on a patient's condition.